I once spoke with a patient preparing for surgery whose care was delayed and disrupted by the system. For him, the question was simple. Could he trust the system when it mattered the most? What may seem like an isolated incident happens more than we realize because it's a part of a system of standards and repeatable processes. Every healthcare journey, whether it's a mother giving birth, a child receiving antibiotics, or a patient about to have surgery, depends on the same essentials: prevention, precision, and accountability. The circumstances might be different, but the foundation cannot be. The foundation is quality. So how can we ensure that quality is embedded into every step of the healthcare system?
Healthcare is a very complicated undertaking. It's 360 degrees of enterprise. It's easy to oversimplify and say, well, it's a doctor talking to a patient or a surgeon doing an operation. No, that's a complete misunderstanding. Health depends on factors way outside healthcare that determine how long a person will live, how healthy they'll be, what chronic diseases they'll have. And healthcare itself is incredibly complex. As we study quality and how it actually gets better or fails, the more you look at it, the more you realize that it's the way the system as a whole is working that determines outcomes and safety, reliability of care. Nowadays, we're trying to build much more continuity into care, where handoffs are explicit, well-designed, and complete, where hospitals are able to communicate with each other using, say, electronic medical records. This investment in cooperation and coordination throughout the system is crucial to patient outcomes.
When I think about the patient preparing for surgery, that's why ASQ exists. It's to advance quality so no patient ever has to feel at risk. ASQ will be 80 years young next year. Established in 1946, to set quality standards, we focus on certification, upskilling of individuals, and working with organizations to make sure that quality management systems are up to par across the world.
ASQ offers healthcare professionals the quality tools and methodologies to improve patient care and patient experience. Understanding a problem is the key to make sure that you're really solving the right problem, and using the quality tools enables you to really dig into the problem to understand the true root cause. Once a true root cause has been identified, process improvements can be identified to mitigate and prevent that issue from ever happening again, with the ultimate goal of reducing errors in delivery of healthcare services. Lean Six Sigma is a tool that healthcare providers often use to evaluate systems and processes, look for ways to optimize efficiency, with the goal of delivering better, reliable care as an end result. Certifications offer proof of an individual's skill and competence within a quality area. ASQ offers certifications to young professionals new in quality all the way up to seasoned professionals to enable them to develop and master the tools to be successful in their roles.
When hospitals and health systems start using these tools, they map process, they understand root causes, and they take actions to start improving clinical care, and that results in medications errors going down, patients feeling safer, and providers, in fact, feeling more joyful in their work. When supply chains adhere to global standards, we see lots of things change. We see surgical kits arriving on time. We see vaccines getting delivered where they need to be. We see critical supplies getting to where they need to be so that patients can receive the care that they want and need. It's the same with the earlier patient stories. When organizations use quality improvement techniques like Lean Six Sigma or PDSA cycles, these methods result in operating rooms running more efficiently and errors decreasing. What was once a system of uncertainty becomes a system patients and families can rely on.
This idea of sharing best practice has been around a long time. And I think what we're doing with American Society for Quality is accelerating this. Making it quicker so you can just click on the internet and see a case study, where you can click on the internet and get a certification in a different process, where you can really understand what process thinking means and process management means. ASQ has been the leader for almost 80 years. It was a simple idea to bring the leading hospitals together, healthcare providers, with leaders from the 25 top companies in America. And now we have thousands of people sharing at the conferences and sharing what they've done that actually worked.
At ASQ, we partner with healthcare professionals and organizations to improve quality to safeguard patients, minimize errors, and deliver care that can be trusted every time. Through collaboration and global community dedicated to continuous improvement, ASQ champions quality that makes a measurable difference for people who depend on it the most. Quality is a practice that saves lives every day.